Before I had MS symptoms, my only association with vertigo was the movie by Alfred Hitchcock. Those were the days. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for almost 40 years. And way back in the day, when I first started having troubles with MS, I told you that my first symptom was optic neuritis, and I had that a bunch of times. But somewhere scattered in there, I had 2 or maybe 3 episodes of what I've come to believe was vertigo. And I'm not talking about the dizziness, the lightheadedness, the poor balance that has pretty much plagued me all the way through, but something that was a lot more drastic, something that was so sensitive that I couldn't move my head without feeling incredibly nauseated. The first time it happened, it only lasted a couple of days. It was enough to prevent me from going to a painting class I'd wanted to go to, I remember. In fact, it kind of wrecked my watercolor painting career. Not that I ever really had one, but the timing could have been a lot better from my perspective. The second time lasted a lot longer. It was a few years later, but I was unable to even get up out of bed without feeling so violently ill that I just ended up staying in bed and reading books for about 3 or 4 days. Until my friend took pity on me and lugged me off to the doc in the box so that I could at least get checked out. We had no idea what it was. I think looking back on it, if I had only known that it really was related to my multiple sclerosis, I might have made some different treatment decisions. But I've wanted to make a video on this for some time because I know that dizziness or loss of balance or lightheadedness or vertigo, they affect quite a few people who have multiple sclerosis. So I thought this would be useful to know. I've gone out checking for information, and there really hasn't been a lot, not compared to some of the topics that I've researched. I did find a couple of things that I'm going to share with you, and I think they're very helpful, and I'll tell you a little bit more about my experiences as we go along. We'll take a look first at a video that's from the National MS Society. It was published in 2024. It's an interview with Dr. Steven Krieger, who is an eminent neurologist in New York City. You may have seen him on some other programs and videos because he's been out quite a bit in the public eye. And I hope you find this helpful. Let's take a look at that, and then we'll look at an article that I found in Medical News Today that I also think gives some helpful information.
Dizziness is a common symptom of MS. People with MS may feel off balance or lightheaded. Less often, they have the sensation that their surroundings are spinning, a condition known as vertigo. Hi, I'm Kate Milliken and welcome to MS Learn Online. To discuss these symptoms, we have Dr. Steven Krieger. Dr. Krieger is a neurologist at the Corin Goldsmith Dickinson Center for MS and an assistant professor at the Mount Sinai Medical Center, both in New York City. Welcome to MS Learn Online, Dr. Krieger.
Thank you.
So, is there a difference between dizziness and vertigo?
There is. Dizziness is a very broad term, common term, and people use it to mean a lot of different types of things. Vertigo, on the other hand, as you mentioned in your introduction, is a very particular description of a sensation of movement where there is no movement. And most often, it's a sensation of spinning when the person is not, in fact, spinning. Some patients can experience vertigo as a feeling that they are spinning around. Other times, patients will describe it as the room is spinning around them. But that feeling of movement, and spinning in particular, is what is very specific for vertigo. Dizziness, on the other hand, can mean a lot. It can mean lightheadedness. It can mean vertigo. Some patients will describe this when they're, let's say, have low blood sugar or low blood pressure. They might feel this when they're tired and say that they feel dizzy to mean they just sort of feel that they can't do it anymore. So when somebody talks about dizziness, the first series of questions that the neurologist will ask are to try and understand what do they mean by dizziness, and do they in fact specifically mean vertigo.
Are there any additional considerations you'll take after that initial inquiry about the dizziness on how you're going to treat it?
Well, it really depends on what they mean and what the root cause of it is. Vertigo is more concerning in a sense as a true neurologic symptom, whereas dizziness or lightheadedness can mean a lot of things which would need to be approached by looking at blood pressure and blood sugar and things of that nature. But if there is evidence from the history of true vertigo, true spinning, there are things that a neurologist will look for on the clinical exam and considerations that the neurologist may take with a workup to understand where that vertigo is coming from.
Do you know where lesions are forming in the central nervous system when a patient comes to you and says they might be dizzy or have vertigo?
Interestingly, yes. There is in general a somewhat poor correlation between MS lesions and MS symptoms. That can be a somewhat a frustrating thing for both patients and physicians and when they're trying to put together a diagnosis. But vertigo is actually very specific. When vertigo is coming from the central nervous system, it is coming from a particular place in the brain stem, which is responsible for balance and coordination. That area of the brainstem is actually right next to an area of the inner ear, which sends its signals. And so one of the challenges when looking at vertigo is to figure out if it's vertigo from the central nervous system, from the brainstem, or vertigo from the inner ear. And anyone who's experienced a sinus infection or seasickness and feels dizzy and vertiginous in that way understands how the inner ear can contribute to feelings of vertigo. So that is what the neurologist really needs to try and figure out. Is it an inner ear problem causing vertigo, which might be treated in a different way than a lesion from MS causing vertigo, which would be in that very specific area in the brainstem.
Are there any management approaches that you would recommend for somebody that comes to you with these symptoms?
Well, first of all, I would say that if someone is experiencing vertigo, they should let their physician know, either their general practitioner or their neurologist, because it is a somewhat complex symptom to figure out, and it can be very unpleasant and should be looked at. Vertigo can sometimes be associated with nausea and with vomiting. Sometimes people will feel that they barely can stand up and have to hold on, and it does prompt visits to the emergency room at times. The management approaches really do require knowing what's causing the symptom. And so I would hesitate to tell a patient to do anything else about their vertigo or dizziness until they've talked about it with their doctor. There are some medicines that can help to treat vertigo. These medicines are really designed for vertigo from the inner ear. And there are medicines that are not unlike those that are used for seasickness that can help with that symptom. They are somewhat less effective when the vertigo is coming from the brain stem if it's caused by an MS lesion. The good news there is that that is often signs of an MS relapse or an MS attack. And I say good news because those are usually self-limited. We can treat MS attacks with steroids and make them resolve more quickly, but someone who's experiencing vertigo will not be doomed to experience that forever. It will be a self-limited experience.
This article for Medical News Today covers it just about as well as anything that I was able to find. It was published on January 9th of 2024. It's called Multiple Sclerosis and Vertigo. Is there a link? And it goes on to say links exist between multiple sclerosis and vertigo as well as between MS and dizziness. Vertigo and dizziness are not the same thing. While vertigo refers to a spinning sensation, dizziness is a general term that denotes lightheadedness, disorientation, or feeling off balance. Both vertigo and dizziness occur in MS when the condition affects the brainstem and cerebellum, which are parts of the brain that play a major role in balance. Vertigo may sometimes result from other causes such as inner ear conditions or medication side effects. And we'll talk a little more about inner ear conditions later, but I do think it's important to notice the difference between vertigo, which is more acute, I would say, and dizziness, which can be kind of chronic. I mean, if you stand up too fast, if you turn your head too quickly, you might feel off balance or lightheaded. That's definitely a side effect of MS. But vertigo is pretty specialized because vertigo is accompanied by incredibly unpleasant symptoms, and it is a lot, as I say, it's more acute than dizziness. You might have an episode of vertigo, whereas dizziness just might be a way of life for you, unfortunately. They go on to say, in chronic or long-term cases, doctors may treat vertigo with anti-nausea or motion sickness medications. Management strategies to promote safety are also necessary to help prevent injuries. This article discusses whether MS causes vertigo and how it causes dizziness. It also examines symptoms and treatment of MS-induced vertigo and lists support group resources. So their first question is, does MS cause vertigo? They say that one of the early symptoms of MS is constant or intermittent dizziness. In fact, a 2020 study cites older research from 2013, which found that 49 to 59% of individuals with MS experience dizziness. The 2020 study also adds that 20% of people with MS experience vertigo, and I was in that lucky 20%. How MS causes vertigo. Dizziness and vertigo usually stem from the development of a new lesion or the growth of an existing lesion on the brainstem or cerebellum. And that's very interesting to know. When I think about my episodes of vertigo, they all happened within the first 5 years or so. My first MS symptom, which I told you was optic neuritis, but I had several episodes of vertigo over the first 5 years or so as I was in relapsing MS and I was getting my first lesions. And I know that some of my lesions were on my brainstem because of some of the symptoms that I had. So this makes total sense to me. And this is the first time I think I really made the connection. They said that the cerebellum is the part of the brain that controls balance, while the brainstem sends and receives messages to parts of the body that affect balance. Sometimes a person with MS may also have dizziness and vertigo due to other causes, which may include, and they give some examples here, inner ear conditions, which I'll talk about later, medication side effects, high or low blood pressure, stroke, migraine, infections such as the flu, or cardiovascular disease. What are the symptoms of vertigo? Well, episodes of vertigo from MS typically can last from a few seconds to minutes, or in my case, several days. The onset may occur without warning. Yes, I will attest to that. Symptoms may include nausea and vomiting, and I did have that nausea part, and I made sure I didn't get as far as the vomiting part, but I was pretty sick for a while. Loss of balance that can result in falls. Well, I wasn't even able to move my head much, so thankfully I didn't fall because I didn't do anything. Hearing conditions such as ringing in the ears, and I did not have that. Dizziness, yes. Vision difficulties, well, I had those anyway. And lightheadedness, yes. So most of those I think I experienced with the vertigo. And then finally, they have something called treatment for MS-induced vertigo. For chronic vertigo, a doctor may prescribe one of the following: meclizine, a medication for dizziness and nausea due to motion sickness, which is available under the following brand names. They list a whole bunch here: Antivert, Dramamine, less drowsy, Bonine, Bonine Max, Dramamine, nausea long lasting, Travelese, Medivert, Dramamine 2, Germinate 2, Divert, Meclicot, Ruvert M, Meta-D, and Verticalm. And many of those I think we've used for things like getting car sick. If you're going on a long car trip, some people use Dramamine for that, or for air sickness if you're taking a flight. I never used any of those, actually. I had another thing that I used instead. And if I had known what meclizine was going to do to me, I would have definitely not allowed the doctor to prescribe it for me. Because what ended up happening with the meclizine, it's essentially a muscle relaxant. And so what happens if your optic nerves are already sort of weak from having multiple attacks of optic neuritis, as I had? You end up with crossed eyes, because your muscles that control your eyes and keep them both pointing in the same direction relax and can't do their jobs. And so I ended up with crossed eyes. Okay, I'll admit it did help with the vertigo, but I had crossed eyes for months. I'm not kidding you. I had to go to work. I had to go to conferences. I went on vacation to Aspen, Colorado, to the Food and Wine Festival, and I had crossed eyes the whole time There are some photos of me. I don't have any on me right now, or I'd show you. But there are some photos of me with crossed eyes, and it's really kind of hilarious. But it wasn't very fun to be on the other side of those two eyes because it was so hard for me to focus on anything. When I drove, I had to use a black eye patch so that I could see the road and not see double. And then there's a couple other medications that could have been used. Ondansetron, which is Zofran or Zofran OTD or Zuplenz. It's a medication for nausea, or diazepam, a medication for anxiety. We didn't try any of those, and now in retrospect, I'm thinking maybe we might have wanted to do that. The doctor that treated me was the doc-in-the-box doctor, and maybe he just didn't know any better. He obviously didn't know very much about MS, and he never even thought to ask me any questions before he prescribed the medicine. So that, I guess I'm just saying as a cautionary tale, so that for you, if you ever find yourself in a position where a non-neurologist wants to prescribe something for you, you do need to make sure that you check with your neurologist and find out if that is likely to cause you problems because of the symptoms of MS that you've been dealing with. They say that when vertigo occurs, a person is at risk of falls and injuries, so management strategies are important. To help promote safety, a person can try these things. You can sit until the symptoms go away. I tried that in the last case, and it took days. My friend finally had to haul me off to the doc-in-the-box because I just couldn't do anything. I couldn't go to work. I couldn't go eat. I couldn't take a shower. I couldn't do anything. Avoiding stairs. Yes, indeed. Make sure that if you suffer a lot with dizziness, that you're very, very careful on stairs. Refraining from moving the head or changing body positions. Yes, as I said, I did that for days that second time, and it was pretty bad. Not driving until it is clear that the vertigo has passed. Dimming bright lights and not reading. Well, actually, I did do a lot of reading while I was suffering from that vertigo episode because that was all I could do. As long as I stayed in bed, I could hold the book and read, and that was fine. I just couldn't turn my head. That was really pretty dreadful, so I did not do that. And then finally, being cautious and beginning to move slowly after the vertigo appears to have passed. If vertigo happens at night, sit up straight and turn on soft lighting. Stay still until it passes. Well, that's a thought. Mine didn't go that way. Other strategies to reduce the risk of an injury include installing handrails and grab bars. I'm a big fan of that. Whether you have dizziness or vertigo, I'm a big fan of having handrails and grab bars. In fact, I won't even go up and down stairs if they don't have a handrail. Removing tripping hazards, particularly throw rugs. Small pets, I think, also fall in that category. Although I don't know if removing them is necessarily the thing you're going to want to do, but you're going to need to be very careful if you have a cat or a dog that's likely to get underfoot. I had a kitten once who thought it was great fun to run down the stairs a couple ahead of me and then crouch down, hoping, I don't know what he was hoping, that I wouldn't see him. Thankfully I did, because that could have been a catastrophe. But to continue, they also suggest you could use a walker or a cane, or you could use a shower chair. And I do use a shower chair, even now, because closing my eyes to wash my hair can be a little problematic. Sometimes I lose track of where I am in space. They call that proprioception, and I think many of you probably have that same problem. So sitting in a shower chair to wash my hair has become just a way of life for me. Additionally, the following strategies may help minimize symptoms. Physical therapy, which may improve coordination and balance, and I'm always an advocate for physical therapy. If you find a good physical therapist, you have won the lottery. Exercise. This involves any regular physical activity. The thing about exercise, I think, not only is it getting you moving and doing all kinds of wonderful things for you and your muscles in general, but specific targeted movements will help with neuroplasticity, making new connections in the brain that allow you to do things that you were having trouble doing. I know that it can take a long time to build that in because your brain is going to keep trying new routes to get the signal to go through. And depending on how much damage you have and where it is, that may take a long time. But keep at it, because neuroplasticity is your friend, and both physical therapy and exercise can add greatly to the benefits of neuroplasticity. Then they talk about acupressure therapy. This targets pressure points on the body that relate to vertigo. I'm curious to try that sometime. I'd really like to try acupuncture for fatigue, but also just for balance in general. Occupational therapy. This can help someone learn how to move more safely in the home or office, particularly during an attack. Again, like physical therapy, that's always very helpful. And log of episodes. Keeping a log of the times when vertigo occurs can indicate when to schedule daily activities. An individual can plan tasks when attacks are less likely to happen. I don't know if you can do that. That's wonderful. For me, the episodes I had came out of the blue. There was no scheduling anything. But I think if it's something you're dealing with in a more intermittently chronic basis, that might be something that you need to do, a strategy that you can develop if you keep a log of when it happens during the day, or what activities trigger it, or maybe what foods trigger it, or maybe lack of sleep triggers it. It's hard to know. I think, like many things with MS, it's probably very individual, but keep a log that helps you know what your particular triggers are so that you can plan your life around that. And then finally, they say also following a nutritious diet may help manage many MS symptoms. And I would take the may out of there and change it to will help manage many MS symptoms, because it will. It may not cure anything, but having a bad diet certainly can make your symptoms worse. So having a good diet only logically follows would make your symptoms better. Maintaining a moderate body weight links to a lower risk of disability and worsening of lesions. And this diet may entail eating a variety of colorful fruits and vegetables, avoiding processed foods and foods with added sugar, choosing whole grains such as brown rice rather than refined grains, and preparing meals at home as much as possible. And that's the extent, I think, of the good information that we have in this article, which I, of course, am going to link below so that you can click on some of the links there and get more information if you're interested. These were helpful, I think. They did connect a few dots for me, and so I appreciate knowing that information, and I hope you found it helpful too. I also want to mention a third thing that I was encountering. There was a time sometime in the 2000s, I guess I'd had MS for 15 or 20 years by that point. I started to have similar problems when I would change my head position. And I remember that it became the most acute when I was going to a chiropractor because I had back pain. And they lay you on that table, and then they want you to turn 90 degrees, 90 degrees. And I was just sick doing that, moving my head that way. So I told the chiropractor about that, and she suggested that I go visit this physical therapist who knew how to treat this inner ear kind of problem that she thought I was having. And I thought, well, I might want to do that, because I certainly can't live this way. I was having trouble turning over in bed at home too, so I knew that this was not going to go away on its own. I did go ahead and see that young woman, and she fixed me up. It was really a quick, I won't say it was comfortable. She put me on a table and she had me lean my head back off the table, and then she manipulated my head really carefully. And I felt really sick when she was doing it. But when she finished, I didn't feel at all sick anymore, because what she had done was take the little otoliths, these little rocks that you have in your inner ear that float around in fluid and help keep you balanced. They had somehow migrated out of the canal that they were supposed to be in, and they'd done something else, and so that was the problem. She knew how to put them back where they belonged, and once that was done, the dizziness and the nausea went away. But I'm quite sure that wasn't what the problem was back when I had the several days of misery. I think that was true vertigo coming from a lesion on my brainstem. That's my diagnosis. And at this point, I might as well stick to it. I'm only going to hope that it's never going to happen to me again. But that's all I have for you today. I would be really interested to hear from you in the comments, though. Have you had troubles with dizziness? Have you had vertigo? Have you ever had this problem with the otoliths in your ears? Let me know. But that's all for today, so until my next video, take really good care of yourself, and I'll see you again soon.